Novel psychoactive substances, referred to as legal highs, are drugs that produce similar effects to illegal substances. Recently, their use has seen major increase, resulting in difficulty to treat cases of substance abuse due to the unknown chemicals used in the manufacturing. The drugs can be classified into 5 groups: stimulants, cannabinoids, hallucinogens, benzodiazepine-based drugs, and lastly, dissociative drugs. Today, we'll be focusing on stimulants, cannabinoids, and benzodiazepine. Stimulants are similar to cocaine, amphetamines, and ecstasy. Traditional psychostimulants target the monoaminergic systems, increasing extracellular levels of neurotransmitters, for example noradrenaline. These drugs block the pumps responsible for the reuptake of neurotransmitters. Many antidepressants exert similar effects on these pumps, and other stimulants may reverse the reuptake of activity. Stimulants are commonly used as doping substances in sport. Regulation of this is challenging due to the ease of access of the raw materials and the difficulty of characterizing the chemicals involved. The release of noradrenaline may contribute to increases in the activity of the sympathetic nervous system. It can cause cardiovascular effects and risks, and hypervigilance. The most common MPS psychostimulant family are caffeinones, which include ephedrine. Studies of these stimulants have shown the strong activation of areas associated with reward sensitization and addiction. Typical effects include euphoria, agitation, and palpitations. MDMA-like substances are often associated with an elated mood and self-confidence, and potential psychedelic experiences, and so they may decrease feelings of anxiety without having a sedative effect, suggesting they could be used in the treatment for PTSD. Benzodiazepines bind to an allosteric modifying site on the GABA receptor. Activation of this receptor decreases the ability of the cell to exert an action potential. The GABA receptor contains an ethanol binding site, which is responsible for the subjective effects of alcohol. The prohibition of phenazepam and etzolam lead to the synthesis of new MPS benzodiazepines, such as pyrivazolam and flumezepam. These substances have been found to inhibit anxiety, as well as having hypnotic, muscle relaxant, and anticonvulsive effects. These effects, combined with the changes to the GABA receptor, may greatly increase the risk of seizures if substance abuse is suddenly ceased. Intoxication with benzodiazepines is similar to intoxication with alcohol in that individuals will be disinhibited, cognitively impaired, with slurred speech and impaired motor control. These substances can be potentially used in the treatment of acute anxiety attacks, agitation, as well as alcohol detoxification. Cannabinoids mimic the effects of cannabis by interacting with cannabinoid receptors CB1 and CB2. These are functionally similar to the tetrahydrocannabinoids THC, an active ingredient found in cannabis, and stimulate the receptors. The novel compounds are typically full CB receptor agonists, rather than THC partial agonism, and some have greater receptor affinity and require a lower receptor occupancy for activation than THC. An example of a synthetic cannabinoid is JWH-018. These substances often act as painkillers, but may also have demobilizing effects. The side effects for cannabinoids include cognitive impairment, disorganized thought, and lastly, appetite stimulation. These drugs rarely cause fatalities, but there is evidence to suggest that long-term substance abuse may lead to psychological issues. For example, Rimonabant. This was used as an anoretic agent in obesity treatment, but was withdrawn due to an apparent increase in suicidal thoughts in patients. Despite this, modulation of the endocannabinoid system has been identified as a potential treatment for Parkinson's, hypertension, and atherosclerosis. There are still many issues involved in the use of cannabinoids, and it would be necessary to know the specific compounds that show pharmaceutical potential for each given disorder. Are they safe? Just because these substances are sometimes referred to as legal highs does not mean that they are safe. The exerted effect may show some promise in treatments of some conditions, but there is not enough information on the chemicals and the long-term effects to know that these substances are fit for clinical use. Although poisonings caused by these substances are often minor or moderate, and cases are rarely fatal, serious complications occur due to the lack of knowledge surrounding these substances.